As Ontario encourages people to get a booster shot, there is a glaring lack of daily data showing them just how effective they are, and they are effective. But there's no data indicating the very small number of triple vax people who are in ICU at this very moment, while people are being told urgently to roll up their sleeves again.
You need your third dose of vaccine as soon as possible.
But the government is providing little data to back up why. Unlike British Columbia, its regular data includes triple vaxxed outcomes. At the end of this latest graph, you can see how few people who are triple vaxxed end up dying or in ICU versus the fully vaxxed or even double vaxxed.
We know how much more effective the third shot is versus Omicron. I think it's incumbent on the government, if they want to encourage more people to get vaccinated, to actually report hospitalization numbers by vaccination status, being 1 or 0, 1, 2, or 3 shots.
Last week, CityNews asked the government for data on how many people with boosters are in ICU, but have yet to receive an answer.
It's exceptionally uncommon. In fact, I've only ever seen one patient who's triple vaccinated in my ICU. And the risk factor for patients in general for coming to the ICU after 3 shots is immunocompromised. For example, being a post-organ transplant. And those patients, are very difficult to protect with any number of vaccines. Otherwise, I've never seen a patient with 3 shots in my ICU, and most of the patients are completely unvaccinated.
A second ICU doctor confirmed to CityNews that the only triple vaccinated COVID patients they've seen are transplant patients. According to a tweet from Ontario's health minister today, more than 4.7 million people in this province have now had a third dose. Ontario Public Health confirms to CityNews as of December 12th, out of the millions who had been boosted by then, there have only been 203 breakthrough cases. Another update from them is expected this week. While the government is not adding the small number of third dose cases to its data, it is going to change its reporting to reflect patients who are in hospital due to COVID versus those who are in hospital with another issue and happen to have COVID.
In my view, I think we're wasting a lot of time looking for, these incidental COVIDs because these patients are in the hospital and their effect on the system is no different than someone with COVID pneumonia.
If the government wants to encourage more people to get boosted, and they are trying to encourage them, they should show them the data day after day after day. I'll end with a bit of positive news. Dr. Warner from Michael Garron Hospital tells me they're seeing some staff who have been off sick with COVID starting to return. He's hoping the rapid upswing in cases we're seeing will be followed quickly with a rapid downturn. But he says the next few weeks will be difficult.